Swadikap, welcome to NBT World's The Fireside. I'm Benjamin Ruchopakaan. Every week, we have a fireside chat exploring what's going on in Thailand, diving deep into our latest obsessions. Sleep is something that we all do, but very few of us understand. Today, we're joined by someone who has dedicated his whole career to changing that. My guest this week is Dr. Amornpong Vachiramon. Dr. Amornpong has over 20 years of experience in the field of dental sleep medicine and holds several credentials from Thai, American, and international boards of medicine. Swadikap, Dr. Amornpong.
Swadikap.
And you also go by Dr. T, is that right?
Yes, you can call me Dr. T, yeah.
Thank you so much. So before we dive into medicine, we want to get to know you a little bit better. I want to know, what got you into this field? It feels so specific.
Originally, I trained as a dentist, actually, dentistry. And I think I actually went through the regular dentist, normal general dentist that actually want to do something more.
Yeah.
I went to train oral and maxillofacial surgery.
Oh, right.
Which is different. Basically, we do face and the jaw and the neck, head and neck surgery, basically.
So oral maxillofacial, that's like the whole face.
And oral cavities, face, head and neck areas. So,
right.
So that the oral and maxillofacial surgery. Wow. And then I actually went through another training as orthodontist, orthodontic training, to be able to do like braces, facial growth modifications.
It doesn't stop. You've been in school for so long.
Yeah.
Like you've been in school your whole career, a lifelong learner.
Yeah, quite a long time. Yeah. I started my specialty training in London, actually, in United Kingdom.
Right.
And I found one thing that actually see that, wow, I want to do something more, that I actually want to help the kids to develop better. And I see a lot of abnormal kids. That's why I went to another big training for my life.
Gosh.
It's a craniofacial surgery training. So we dealing with and we treat the patient with the craniofacial anomalies, which is skull, face, and abnormal genetic syndromic disorder.
I see.
So that all involved with abnormality of the genetic mutations, abnormal facial, all the facial deformities, and involve the airway. At that point, I felt that we need to do something with the airway. We need to do something with the airways. So a lot of kids, over 60-70% of the craniofacial kids, abnormal disorder kids, they have the sleep disorder.
Right.
They have a sleep disorder.
So that became the common factor.
Yeah, particularly obstructive sleep apneas involved in this kind of craniofacial anomalies. That the point that I think, wow, this is when I look at the incident that happened, it's not only the craniofacial disordered kids, it a lot of people that don't lay people who get like the facial in communities has the sleep disorder too.
Like it was affecting a broad range of people, not just specific disorders, not just genetic disorders.
Yeah. So when we look at, particularly when we look at, friends and people I know, they all have like snoring, sleep apnea, stop breathing during the night, that kind of thing. That actually, wow, I think this is not the issue. And when I talk to them, what you're gonna do when you go to the doctor? What they have a stop breathing, they have a sleep apnea, they snore. They go to the doctor put a CPAP on them and say, oh, I got to sleep with the CPAP machine every night.
And that's it. That's
it.
The end of the story.
Well, I say, this is so boring. I got a big machine like the vacuum
It's
machine,
loud.
like you see that machine?
Yeah, yeah.
It's like a small vacuum machine.
Yeah, yeah.
At home, and
It's big.
And you put it on the nose and actually pushing the pressure on your nose, and wow, that a lot. And you got to use this machine for the rest of your life. That's going to be very hard.
Yeah. I would imagine it's very disruptive, not just for the person that have to sleep upright all the time, but also for their partner.
Yeah.
Because it's not a quiet machine, right?
That's correct.
It can be kind of
loud.
it's
very noisy in the old day.
Oh yeah.
Now it's improved.
Now it's better. Right?
Now it's much better and smaller too.
Oh,
in the old day, it's a very big machine.
Right.
And 25 years ago, it's very hard when you go to the hospital and sleep medicine is not really worldwide. It's very hard to get the doctor to specialize in this kind of treatment. And only one single modalities of the treatment, the major, they giving the sleep
medication.
pill. Either giving a sleep pill or use a CPAP machine. That's the very most common thing that the doctor prescribe.
Yeah.
So when I look through the literatures and I feel that is other modality, any research actually being done, but we need to develop this.
Yeah.
We need to bring out of research to the real life, right? So that's why I started to emphasize on what we should do and correct and learn the dental sleep medicines and looking at the sleep medicine in variety of the treatment. That the point that actually turned me into the sleep medicine.
Right.
Yeah.
I see. So was that the inspiration for the clinic? Is that the Vita Sleep Clinic?
Yeah, that's correct. I think if I were a patient, I want to go to the clinic that have other choices for me. Not only a big machine that putting on my nose and say, I snoring, I stop breathing, I got to use this thing the rest of my life. So I started this clinic because we have to find other alternative treatments.
Yeah.
That patient can have the right to choose with other treatments that suit them.
Yeah.
Or they can wean off. They can stop using that big machine, or even stop taking the sleeping pill.
Because you can't take sleep pills forever.
Yeah,
right?
and
that's bad for you, right?
Yeah, it's not. You can sleep better for a very short period of time.
Yeah.
And then you're going to get worse with, addictions.
Yeah.
When you...
Resistance.
When you use the sleeping pills and you cannot sleep anymore. That's one of the issues that's going to happen, and it's actually bad for your health.
Yeah.
It not only, the medication have a side effect, has a complications. When you take it for the long-term use of medication, you're going to affect your vital organs.
Yeah.
Your kidney, your livers can damage all of that thing.
And these things, like, the problem is not drug or hormonal; it's structural too, right? It's the structure of the airway that can lead to these sleeping problems.
Yes. It's because the airway can involve with one of the sleep disorders, many sleep disorders. For example, like obstructive sleep apnea, if you cannot breathe well during the night, you cannot repair, you cannot sleep. The quality of the sleep is getting worse, right? And it can damage your heart, you can damage your brain. That thing can involve so many things.
Because you're basically unconscious for so many hours, breathing the wrong way.
Yeah.
So and over maybe one night is fine, but over weeks and months and years, it can add up.
That's correct. I think it's all related. The sleep and the health, brain functions, and all systemic problem that are going to happen in the futures.
Right.
even the immunities.
Yeah.
Right? If you cannot sleep well, your immune reduce.
Yes.
The quality of immune is reduced. Right?
Yes.
Yeah.
Can I ask, so in your view, what do you think are the biggest misconceptions about sleep disorders?
People think the sleep is a downtime,
Uh-huh.
which is not.
Oh,
right?
interesting.
People think that, when you feel tired during the day because of your hardworking modern life, it is not.
Right.
I think that sleep, people always think that sleep is a downtime. It should not sleep too much. If I sleep
Right.
too much, it's just wasting my time.
Right. They're not productive.
Not
they're
productive.
They're not getting stuff done. It's getting in the way of their life.
They don't know that the sleep is everything. Sleep is foundation of well-being.
I
right?
see.
What does it mean? What does it mean that, repairing time of your body, dumping the brain, the brain waste, the waste in the brain, it's been clearing off during the sleep,
Right.
right? It's so many things that actually involve with the sleep.
Tell me a bit more about, like, when you say brain waste, you mean like all the everything we've been thinking all day.
Oh, I mean, sometimes you have the bad thing, the bad substance that actually in your brain,
Oh, right. So it's an actual like
the
actual waste
waste in
chemicals
your brain.
that accumulate
The
in the
chemical
brain.
need to be dumping out during the sleep.
I see.
That actually involved too.
I
right?
see.
So it's so many things that involve in not only, the stress relief during the sleep. It's so many things that happen during the sleep time.
Yeah.
Right.
So I want you to help our audience here decide for themselves, or pre-screen almost. What are some common symptoms that the average person can see that they have a sleep disorder and maybe they should see a specialist?
Normally the most common one is they cannot sleep.
Right. They just say they can't
If
sleep.
they cannot sleep and they feel tired during the day, and they feel like mood swing because they feel very tired, the memory loss, that kind of thing, it can be related to sleep. They should see the doctors, okay, the specialists.
Yeah.
Another one that, even they sleep very long period of time, like 8 hours, 10 hours, or even longer, but they still feel tired or
That's
during
me.
the day, or they still have a daytime sleepiness.
Yeah.
They could have the sleep disorder, some kind of sleep disorder. If they snore, if they snore, and when they snore, they stop breathing. They snore, the certain time and quiet,
Right.
and start to snore again and stop. That cycle, it could be the sleep apnea. Could be
It's
the
a very
sleep
specific
disorder.
kind of snoring.
Yeah.
It's like it has to be the snoring and then silence.
The snoring is the sign of small airway, right? People can snore because the small calipers of the airway creating the vibration sound. When you can have a narrow airway, that can have a turbulent sound.
I
The
see.
turbulence airway, the air go into the airway, creating the vibration and creating the sound. So snoring is mean that your airway is small, right? Once it's small enough or it's obstructed, completely obstructions, it can be sleep apnea,
Yeah.
which it can affect your heart. It can be like
Then it starts
the stroke.
asphyxiating your brain and your heart
There's
and,
so
and,
many-
and the rest of it.
Yeah, that's great.
Okay, so can I ask, like, do you think we're seeing more sleep disorders in the modern age, or do you feel like it's just an awareness, a growing awareness? What do you think is happening?
With a very hectic life in nowadays, people actually go to bed very late.
Yeah.
Even sleep less, and not pay attention much on the sleep quality.
Mm-hmm.
The incident is shooting up. It's actually shooting up, rising up the sleep disorder that we found nowadays.
Yeah.
So I think we need to educate people, that how to get a good sleep. Not only it's good quality sleep.
Yeah.
It not only
Not just long.
the time. Right? Could be like if you sleep too much, longer than 9-10 hours, that disease,
Yeah.
that can affect your body and you actually shorten your lifespan.
Oh, that's interesting.
Right.
Because some days I'll just sleep forever and I'll still be tired when I wake up.
No, so basically you need to sleep good quality sleep at it's just a certain period of sleep. The time is not be too much, not be too short. It's just appropriate time. Yeah.
We've talked about the CPAP machine a lot and how limited it is in terms of treatment. What are some other ways that you're treating people?
Nowadays, we can categorize the treatment into non-surgical, non-invasive, and surgical treatment.
Right.
If we look at the surgical alternative, it can be, we can use the MAD device, which is an oral device.
Okay.
Put in your mouth, actually open up the airway. It's like retainer.
I see.
The mouth guard, let's say that. It looks like the mouthpiece. Put it in your mouth, open, and actually hold your jaw and your tongue forward. Open up the airway. So during the sleep, they can breathe better to help to improve the sleep apnea, stop breathing during the night. Or even in kids or even young adults, we can use orthodontic treatment helping them. For example, expansions, helping to expand the upper jaw to help with to improve the nasal breathing, to breathe better, or even they can breathe better because the airway size is larger.
I see.
They can breathe better. The quality of the sleep improve, right? If you have a sleep apnea, and alternatively they can have the radio frequency treatment.
Oh, what's
that? That just like a small probe.
Oh.
We just numb the palate or nose or the tongue and put the small needles into your soft tissue and deliver the radio frequency energy to the areas, helping to tighten the sagging area.
Oh, so that it gets more of the mouth out of the way. To clear the pathway.
Create larger airway.
I see.
So helping to tighten the soft tissue components around the airways
that are constricting the airway.
Yeah, just open up the airway more so they can breathe better.
Right.
Right. There's so many ways to use. Even now, a lot of people don't want to use the oral device, don't use the CPAP anymore. They have very severe obstructive sleep apnea. Jaw surgery can be another option too.
Right. And that's in extreme cases.
Yeah. Or some of the patients say, I have a moderate type. I want to improve the obstructive sleep apneas. They have very small chin. They can get the jaw surgery to improve the airway.
And that's a more permanent solution than
correct.
a sleep apnea.
However, additionally, they get aesthetic result also. So they can improve at the additional result. right?
So there are also procedures that benefit sleep disorders that also have a overlap with
Yeah.
aesthetic procedures.
That's correct. When we look at the aesthetic procedure, so many aesthetic procedure can damage or can reduce, shorten your lifespan.
Oh wow.
That I normally, right, we normally treat the patient use like, health oriented aesthetic treatment. Right. If we're going to do some of the aesthetic procedures, we make sure that actually can expand their lifespan, improve the well-being of the patients,
The
rather
quality
than
of life.
the quality of life, that kind of thing, rather than just damage them.
Right.
We very important of the treatment, not only aesthetic, we do no harm to the patient. We even improve the well-being of the patient too. That's very good.
I've always wondered, like, I've heard on different podcasts that sometimes braces can hinder or create some of these sleep disorder problems, like by making the mouth smaller.
Yeah.
Is that something that parents should be considering?
That's correct. It could happen actually. So when we look at the patient, we not only taking the teeth out, getting the braces done. It's not that, not just only that. We need to examine and evaluate the whole health,
Right.
and the whole airway of the patient before that orthodontic treatment. Right.
Because there's so many different systems related to each other.
That's why it helps oriented planning, very important. It not only super specialized looking at the teeth only.
Yeah.
That's not going to help, because that one of the, I think in the modern medicine, we too specialized in what we do, right? Sometimes when you too specialized with looking at your specialty area, we actually miss out so many other part of the body too.
I've been wondering about that, because I feel like financially that's where the incentives are. Like it is good for your career as a medical professional to specialize, but then if you specialize in one area and you miss how they interact with each other, because the body, it's all related to each other. Like all the systems are related to each other.
That's correct. That's why I actually train in many specialties, because I think it's actually it's not only our specialty that we need to know. We need to know other specialties too, to be able to treat the patient to get the most benefit to the patients. Yeah.
Well, before we go, we're just about out of time, but I want to get your thoughts on Thailand as a medical hub. I think that Thailand has had these aspirations to be a medical tourism hub and to be the hospital of the world to some degree, because we have such fantastic doctors. What are you excited about in the future of medicine here in Thailand?
I think right now, people more excited about the sleep wellness, let's say sleep quality wellness, and technology come. I think for Thailand, we can be the medical hub for not only tourism actually.
Yeah.
Not only touring around, we actually have a lot of, the environments that for tourists to come. And we have like the traditional treatment for the sleep disorder.
I see.
With the traditional Thai medicine, which is another thing that can be involved. And even the sleep hub, a lot of people come to get the sleep quality improved, or even correct the sleep disorder. Particularly, we have really modern technology can do minimally invasive surgery. The patient can come, and within couple of days they can fly back.
Right.
And get a good result and long-lasting result, expanding their lifespan. So this is, I think, is coming, and we can develop into that direction. And we can follow up with telemedicine or even AI right now. You say that right now, even orthodontic treatment that need to be follow up after jaw surgery can be done with the AI. You know, the AI can scan your teeth and use a telemedicine to treat the patient.
I see.
Use the AI to monitor the patient through the mobile application. Wow, this is actually changing the world. The world becomes small. We can treat the patient through the telemedicine.
Right.
So they come over. A lot of things can be treated through the telemedicine. And if we have to do like physical, surgical treatment, they come over with a modern, minimally invasive surgery. They recover very fast.
Yeah.
And they go back very quickly. They don't have to stay for a very long period. In the old day, they might have to stay months.
Right.
But now it's like days.
The downtime is really short.
Very short.
Right.
They fly back and the world become very small. With this kind of technology, I think the medical tourism become like, getting more and more popular.
Great. So it's accessible. It's, it involves more holistic traditional medicines as well.
Yeah.
And it's easier than ever to follow up through telemedicine.
And the tourism in Thailand is the benefit for them also.
Yeah, for sure.
So they come for surgery. They can have like touring around Thailand at the same time.
Yeah.
That's the benefit of it. Yeah.
Amazing. So now we turn it over to our audience. Do you struggle with poor sleep? And did you recognize any of the sleep disorder symptoms that we mentioned? Let us know in the comments section of NBT World's online channels. You can find us on YouTube, Instagram, Facebook, and Spotify. Thank you so much, Dr. T. Sawadee krap.
Pleasure.
And we'll see you on the next one.